There are four pillars to mastering extremities as I see it. Pillar number one is neurological clarity. This is where you want to understand how a misalignment or subluxation in the extremities affects how our nervous system is functioning. How that happens is what we call the noisy joint concept, to where when that spinal misalignment happens, that creates dyskinesia, and that affects the afferent signal going back to the brain. So how the brain is receiving information from the periphery is going to be altered, or there's static on that line. We call that disafferentation. And that leads to dysautonomia, which means now our nervous system isn't regulating between the parasympathetic and sympathetic nervous system. That's going to kick up the fight or flight a notch. It's going to create a more sympathetic operating system, and that leads to dysponesis, which is now our energy is down because our energy is all over the place and it's not focused on what the body needs to do and how we need to live in the world. That creates a perception problem. Perception problem affects our relationships, our creativity, the work that we do in the world, and our quality of life. Pillar number two is where technique lives. This is the hardest one to master because now we have to specifically identify exactly what needs to be adjusted and how we need to adjust it. So now we're going to specifically use four criteria: visualization, static palpation, motion palpation. That's our hands-on. And then we also teach you how to take x-rays on the shoulder, the elbow, the wrist, the knee, foot, ankle, and even the TMJ. So now we're going to confirm our misalignment, and I get a listing from that. Therefore, now we know how to adjust and correct that, which we're going to specifically show you how to get that adjustment rocking. And we're going to teach you about the kinetic chain hierarchy, where now we need to know where to adjust. So we're always spine first, but there's major stabilizers of every single joint. The shoulder, for example, the scapula is a major stabilizer, so we have to address that first. So in the upper extremities, we're going to look proximal to distal, and then in the lower, we're going to identify distal to proximal because of the weight-bearing component. Pillar number three is going to be, now we have to do some care planning. We have to create a plan and a path for the patient to understand where we want to take them. That is going to involve a report of findings. So just like we do the spine, we're going to do that thorough analysis like we talked about. We're going to take x-rays, and now we're going to educate our patient exactly what we need to do to correct it. We're going to answer four questions: what's causing the problem, how are we going to fix that problem, how long it's going to take, what that investment's going to be. And this is where you care plan and have your finances in order to value stack their plan, so that not only are they going to get better results, but you're going to increase your revenue as well. Pillar number four is we're putting everything together: clinical mastery, where now we're really identifying the neurological component. We're helping that patient optimize their nervous system. We're finding exactly what's causing the problem, fixing it, correcting it. We have a care plan, a plan, and a path for that patient to follow, making sure they're showing up for their visits and getting amazing results. And there's huge value exchange in that process. And this is also where we're going to be able to understand 40 plus conditions that are in the extremities that chiropractic can help. So there's patients out there looking for you, they just have an elbow problem or a knee problem that you haven't created awareness in the marketplace digitally via social media, SEO, different things like that, and also within your practice.